Hey, what's up, everybody? My name is Danny Kalala, and I'm here today hacking Stephanie's page. You may wonder why I'm here. Well, we're here to talk about something that you see right above us, and that is the fact that addiction sucks, right? It
Sucks.
totally sucks. We know that. And we're here to talk today to any family member that might be loving an addict to death, that might not know where to turn, that might not know what to do. And we're also going to really talk about some benefits of using out of state treatment. So stick around for that. But for anybody that doesn't know you, why don't you introduce yourself and what you do?
My name is Stephanie, and I am a nationally certified intervention professional. So I travel all over the country doing interventions, kind of like that first responder that works with the family. Sets not only do I get the one that is struggling into treatment, but I am the one that's providing the appropriate medically necessary options, whatever those might be, whatever level of care for the one that is struggling, as well as the family.
To be clear about what you do, you're there to handle everything.
Everything.
So
All they
you're
have to do is pick up the phone.
that's going to be the hardest thing, and we're going to talk about that. But from a standpoint of why you do this, because we're going to talk about how addiction affects families, you aren't just somebody that's like, hey, this is a job I'll take. You have a
Mm,
history of you loved an addict and
I
it
did.
wasn't awesome. So why don't you talk a little bit about that experience?
So I was married to a alcoholic for 10 years, who's also the father of my two young children. And I didn't know where to begin when I needed to get him the help that he needs. I was calling treatment centers. My calls weren't being returned. I didn't have a me, so to speak, like somebody like me who does what I do to help me and guide me
Mm-hmm.
in the direction that I needed to go. So it was very, very hard, very, very, very stressful. Um, and I pretty much lost it.
Yeah.
I was just as sick as he was through the hardest part, just with codependence, and I was so consumed with trying to keep him alive and raising two babies at the time that I was not taking care of myself. I
Mm.
was not.
And you might be relating on the other side of the camera because this story is hers, but she's not unique. You yourself are going through something similar like this: the pain, the anguish, the loving someone to death. And in fact, you've gotten to this point knowing what you would do differently moving forward, and you get
the
to
one
direct
thing
families.
the honestly, Danny, the one thing, and I actually spoke with somebody who I work with close in the industry about this last week. The one thing I wish I did differently is I wish I had out of state treatment options.
Mhm.
I really feel like the outcome would have been different if he left the state, because all his friends okay, notice, like, who he thought were his friends, who were sitting at the bars and getting hammered and plastered with him, and he needed to get away from that. They weren't friends for the right reasons. They weren't friends. And so I feel like it would have been a different outcome if he would have left the state for treatment. So that is something that eats at me a
I
lot.
get it. And we're going to dive right into that too because you can help anybody anywhere, but we're going to talk specifically today about those three benefits of out-of-state treatment. This is
It's
leaving your
important.
yeah, why don't you talk about that? What are these three benefits?
So it's people, places, and things. Super, super, super important, beneficial for so many reasons. And I'll share a couple with you. To leave your playground for treatment, you got to leave those people and those places and those things, like the people you were using with, the things you guys were doing together, and the places you were getting high at, and could be very, very triggering. It's just, and when you leave a state for treatment, the likelihood of leaving early against medical advice before treatment is complete is very more than likely not to happen. I haven't seen it happen very often,
That
maybe
makes sense. And
once.
why is that? Because they don't have their friends that can come pick them up. They don't have their places they can go crash. You're literally when you move them out of state, you're literally taking away a lot of these support nets that they could fall into and be like, because every addict's going to be like, F this place. I'm
Exactly.
ready to leave. They're
Abs-
treating me horrible, loved one. They're, the stories that I'm
oh,
sure are heard in the industry.
I'm blocking AMAs all the time,
Yeah.
all the time. I'm like, put them on the phone with me. I'll remind them what they have to lose if they don't, keep their head on right and do what they got to do. And it's just sometimes I have to remind them of what they have to lose if they walk out and they end up staying. It's very, very beneficial to leave the state for many, many reasons. Build a new life. where it's in a healthy environment and you don't have all of those triggers
Hmm.
and people who say they're your friends, but let's be real, if they were really your friends, Danny, don't you think that they would support your recovery and
Yeah.
want what's best for you? Exactly.
And we know that's not the case.
So most of the time when I do this, Danny, it really is. It's not the one that is struggling that needs a treatment that reaches out to me.
Hmm.
9 times out of 10, it's a friend or a family member. So if anybody out there has a loved one that's struggling, just pick up the phone. It's the hardest thing to do, but once you do it, you'll be glad you did.
Hmm.
And something else I just want to say that that's really really important is, who cares if they're mad at you? They might be mad at you for picking up the phone and reaching out for help and starting the whole process of a possible intervention. They might be mad at you, but they'll be calling you within 30 days and thanking you for saving their
That's
life.
true. That's
Happens
that
all the
way every
time.
time, right? It's
Every time.
the first. It's pain to stop doing something you've been doing, even though they know it's killing them. They're
Mm-hmm.
ultimately, it's a mental health thing as well. It's
Exactly.
a thing that helps them cope. It's a thing that helps the pain of life go away. And you're
And
right. Once they hit that 30-day mark, it has to change drastically.
exactly, and 9 times out of 10, there is a dual diagnosis. There is
Hmm.
why. It's not necessarily how much they're drinking or how much they're using, or it's why. We need to ask them is, why are they using? Why are they drinking? What happened? And it's sad. It's sad.
Right. And if you're an advocate and you support Stephanie as well, please do share this content. Just by you clicking the share button can actually help somebody see this who could be at the worst moment of their life. It could be an addict that's going through something. It could be a family member that a wife and a husband are back to back in bed, scrolling for treatment options, not talking to each other, having the worst day of their life.
Mm-hmm.
And this video could pop up and give them some hope that they can actually pick up the phone and
Yeah,
call a human being, not just a treatment center, a human being that's going to
exactly.
pick up the phone and going to help you get whatever it is that you need. And we know that phone is 10,000 pounds, but take that first step because I'm sure everybody that you work with wishes they would have called you earlier.
Oh, absolutely, absolutely. I have people all the time, like even my the patients that I've worked with, they tell me all the time that they wish that they reached out sooner, and I
Hmm.
promise, if you pick up that phone and call my number
Hmm.
right there, I will do the hard part. I will find the appropriate resources that
Hmm.
are available, and I will do all of that part. All you have to do is pick up the phone and reach out.
I love that. And I love that there's somebody like you for these people to
Thanks,
actually
Danny.
reach out to and have a
Mm-hmm.
conversation. Just because you call her doesn't mean you're sending your person into treatment and you got to put down a deposit of 10 grand. None of that stuff. This is information.
Mm-hmm.
Call her for questions. I don't know what to do. She'll get you to where you need to go. So I'm thankful that we have people like you in this
Thanks,
industry to
Danny.
support these other humans through the hardest
Right.
times of their life. And again, if you need more information, the phone number is right above Stephanie right now. Reach out, share this with a friend, help somebody that's going through something big get what they need and get the support that they need. So, go ahead.
And a lot of the times, if a lot of people don't know that your health insurance a lot of the times could cover most of the treatment costs,
Right.
and we don't want, and like I said, if no insurance, no, we'll find something. I will not give up until I find placement.
I love that. So thanks
Thanks,
for your
Danny.
time today. Thanks for dropping some information and knowledge on these people out there. And again, share the content, get it out there. We want to see more people get over the hump and get onto wellness in their life. So thanks again for your
Absolutely.
time and thanks for letting me hack your
Thank you.
page today.
Yes.
Bye bye, everybody.
Bye.